Hi there and welcome everyone. Thanks very much for joining. My name is Bill Callery. I'm Manager of Programs and Knowledge Exchange at CDPAC, and I'm going to be moderating this webinar and providing technical support. For those of you who aren't familiar with CDPAC, we're a network of many of Canada's largest national healthy living and disease prevention organizations who've come together to work on the common determinants of chronic disease and promotion of healthy living. Our website and social media contacts are at the bottom of the screen, so you can check us out online. So today's webinar, it's part of a three-part series. It's actually the final webinar in a three-part series called Food Environment Assessment. We had a Part 1A and a Part 1B, so now we're at Part 2, linking evidence to policy action on the food environment. So today's webinar is going to introduce a number of tools and examples to help with pulling forward some of the evidence and insights gained from our previous webinars and from food retail environment assessments to help influence policy and decision making. And at CDPAC, we're really thrilled to be working with our presenters and with Health Canada to bring you this webinar because we know how food environments affect people's opportunities for healthy living. I'm going to turn it over to our presenters now. We have two great presenters. You may have heard them on the previous webinars, Dr. Leia Minaker and Dr. Catherine Mah from the University of Waterloo and Memorial University, respectively. And without further ado, I will turn it over to Catherine Mah.
So thanks so much, Bill, for the introduction, and we're really excited to be here with you today again, back for Part 2, which is actually a Part 3 of this series. And today's focus is going to be introducing some of the tools and broader tools around the Food Environment Assessment Manual that we're introducing through the Fresh-It project. And you'll see the image there, and I'm going to speak to our website resources a little bit later in the call. So just to go over kind of what the outline for today, we're going to talk a little bit about what we heard from you after the second webinar. We're so grateful to have your evaluation results and to see kind of what kinds of actions are you guys taking on the food environment, and kind of what are your burning questions and what would you still like to know. So we've really kind of taken these into account in planning the materials over the course of the three webinars, and we're going to introduce today. Then when we get into the meat of the webinar, I'm going to speak really a lot about, you've seen our diagram before that introduces relevance. So today I'm going to talk about relevance in light of evidence, but also policy, and how we can begin to tie the three parts of evidence, assessment, and then policy actions or other interventions in context altogether. So it's really about kind of taking assessment to action and then back again. And then I'm also going to just give a little shout out to our friends in Alberta around the policy readiness tool, which will also be available as a link through our Fresh-It website. And then finally, I'm hoping to leave lots of time for questions and discussion today, and you're very welcome to raise questions about today's material, but also if you still have questions that are unanswered from previous materials, Leia and I will be really happy to do that. Okay, so on the last webinar, we heard from you. There was actually a few more people from policy and health practice that we heard on the last call as compared to the first call. And we also saw a lot of related to that, over half of the responses on the evaluation were from municipal, regional, or provincial government. So we're really excited to see that, and we hope many of you have kind of returned today. What we are also seeing is that you're beginning to kind of expand the range of activities that you're doing to apply this information that you're getting through the webinar series, including networking with your colleagues, but also other stakeholders in your region, coordinating with people, cooperating with people, and then sort of the deepest level of engagement, collaborating with people on working on an assessment. But you still had kind of lots of questions and ideas, so we were going to introduce some of those as we talk today. Your key next step was really interesting to me. That we heard that you're planning assessments, that you're kind of really excited to use the material in the Food Environment Assessment Manual to start doing some measurement and some assessment of your food environment. But we also heard that you're going to take some time to evaluate the context, to set out the rationale for doing that data. And we actually had quite a few comments about collecting less data. So I think that's something that Leia and I have kind of increasingly talked about and kind of applied ourselves. So we're really kind of happy to see that was reflected in the evaluation as well. Your key questions and ideas included parts like a lot of kind of what we presented already sounds a lot like research. So some of you asked kind of what part of this is actually research and what part of it can we apply in practice and policy. And I'm hoping to kind of share today that a lot of it, in fact, almost all of it, is really very practice and policy oriented, and it's actually us researchers that are kind of intervening in your area. And the second is that do we have any specific examples of food environment evidence, which includes evidence from the literature as well as assessment evidence that you're creating in your jurisdictions, influencing change. So I'm hoping to cover some practical examples from my own work in Newfoundland and Labrador specifically, but I'm also going to raise some other examples as well. Thirdly, you asked about working with specific data. So people had questions, for example, about the NEMs. So kind of how do you use the prices or other NEMs numbers? So that may be something that will come up again in the question period. So I'd encourage you to kind of ask that. And Leia's here on the call to address some of those a little bit more specifically. But I'm going to talk a little bit more about framing. So one of you asked, how can we really address this idea of the food desert framing, which is, it's so popular, it's in the media, it's kind of widely understood. How can we incorporate that framing into our food environments work, even if we're living in a food swamp? Finally, a lot of you asked how to begin the process step by step. So I'm going to introduce some ideas of steps that you can take related to the evidence that you have in the literature, but also in relation to your policy environment. So before you begin and before we begin, I'm just bringing up this slide again for those of you who have been on previous webinars. This diagram is from our Food Environment Assessment Manual by Health Canada and by Leia Minaker. And really this image is to point out that today we're going to focus a lot on number one, relevance. So in order for you to kind of get into doing food environment assessments and to be developing responses, a lot of what's rooted in is figuring out what's the kind of problem that we're trying to solve about food environments in our region. So the first thing I'm going to talk about is evidence in context. And again, by evidence, I'm referring to evidence that we might already have in the literature, which a lot of it has been synthesized by Leia and then also over the last couple of years or so. So we're going to point to some of the key evidence for you and then talk about how to bring that into context. So just to recap about kind of what do we know about the retail food environment generally, but also specifically in Canada. So what we do know is that the evidence is really mixed. When we're looking at dietary and weight-related outcomes in particular, there's really a question about kind of what is the impact of the retail food environment on this diet and health-related outcomes. However, kind of with that mixed impact, we do see that about 85% of studies do show some association between the food environment and people's health and diets in the expected direction. And by the expected direction, we mean that we're expecting to see that if food environments are less health promoting, or if there's greater access to less healthy food options, then you have poorer diets and adverse effects on weight. The second kind of what do we know about the evidence on the retail food environment is that most of the studies, particularly in Canada so far, have been done in urban areas. This is actually true of the U.S. literature as well. And right now we're conducting a systematic review of the rural food environment literature, which a lot of it has come out of the United States, but some has come out of other countries with rural and remote areas, such as Australia, and also from Europe and the UK. But overall in Canada, these studies, which are largely focused on urban areas, have demonstrated that the evidence seems to be stronger for the existence of food swamps than food deserts. And for food swamps, for those of you who aren't familiar, is the idea that there's a greater access or an excess access of less healthy food options in that same geographic area that we're talking about. The main kind of hitch is that there's a great deal of methodological heterogeneity. There's many, many ways, meaning there's many ways in which people are measuring their food environments and many ways in which people are measuring the outcomes. So that kind of limits our ability to make generalizable comments about the literature, but that's precisely the reason why we're kind of really going to talk about how to apply the evidence in your context today, because kind of amid that heterogeneity or amid those kind of mixed effects, how do you start to make sense of all of that and develop some actions that are really relevant and useful for your practice and policy context? So before I get into kind of my specific example, the other point that I wanted to raise is that one thing that I really like to remember at the end of the day, so I'm a population health intervention researcher and kind of previously practiced as a physician, and I'll always remember kind of the first couple of months and graduating as a fresh pediatric resident and then coming out into community practice and then realizing that all of the wonderful things that I had learned about and was ready to do in the hospital setting were all of a sudden thrown out the door as soon as I entered into the community. And 96% of my day was in general practice in the community was talking about school settings or parental relationships or adolescents and their relationships with their schoolmates or with their friends in the community or access to grocery stores or income or other kind of factors at the household level or in their schools or in their communities that were very much most of pediatric practice for me and not necessarily kind of all the health care bits that I had been prepared to implement. So again, when we're thinking about the retail food environment, what we're really doing is talking about social change. When we're talking about introducing, beautiful fresh fruits and vegetables into a corner store in a rural area, what are we actually doing there? We're not actually kind of, it's not only about health, it's actually about changing people's lives and relationships in that community. So that's something that I always like to point to and always like to remember. And it's really related, I guess, to our kind of our underlying principle in public and population health, which is healthy public policy. So that even if we're really, really interested in measuring behavior and health outcomes downstream, essentially what we're doing is we're doing world changing. We're changing society, the social environmental conditions in which choices are made. Another way of kind of talking about this is around kind of the population burden of disease curve. So many of you may have kind of seen this approach. And the idea with population health interventions, we're trying to actually do two things. And the wonderful late Pat Martins in Manitoba used to call it shift and squish. So the shift is actually moving the curve so that the kind of whole population begins to shift and shifts the entire distribution of disease. But what she used to call shift and squish was actually squishing those high-risk individuals more into the middle of the curve, so actually squishing up that curve. And if you could kind of see me in my office right now, I'm trying to doing a squishing motion with my hands, and that's exactly what we're trying to do with the population burden of disease. So what's actually normal? What are we trying to shift and squish when we're talking about shopping in retail environments in Canada? Well, the social normal is actually that 70% of every food dollar in Canada that's spent is spent in a retail store. So this is something I always like to remind myself because we talk about, I do a lot of work around food systems and there's lots of ways to engage people in food systems, but we can't forget that 70% of their household money at the end of the day is going into retail environments, and that's why I think it's a really important area for intervention. The second, the squish part of the gradient, or the squish part of the population curve, is this idea of a gradient. So what the evidence shows us so far is that the lower the household income in Canada, the greater proportion of household spending that it appears to occur in stores versus restaurants. So again, kind of another rationale for why we're really interested in looking at retail food environments, and in particular, kind of store or a vending or kind of canteen locations, in contrast to eating out establishments, because that is where the lower the household income, the greater proportion of spending seems to be happening. So how does this all kind of relate to real life? So I'm going to tell you a little bit more about the example of our Healthy Corner Stores NL project, which I've introduced on previous webinars, but just to give you an idea of how the evidence gets situated in this social context. And what do I mean by kind of just changing people's lives or the community in this area? So this is a picture of Kareen's Gas Bar in beautiful Branch, NL. I really encourage you to all visit sometime. Population is 235. There's about 135 households, a few more in the summertime peak when people come back home. And then about 80 active and open households in the winter. So a relatively small community. At peak, Branch was about 400 people, but that population has decreased over time, and it's been relatively stable. Unlike other rural areas in Newfoundland and Labrador, where there is a high proportion of an aging population, Branch is one where we actually see a remarkable distribution of population over all age groups. So there's actually quite a few young families that have moved back into the area and have young children, so much so that the school used to move away. The school had moved out of the town into a bigger town down the road a number of years ago, but the majority of the school now, in the last couple of years, is actually made up of Branch kids instead of the kids from the other communities. To give you a sense, for those of you who aren't familiar with Newfoundland, kind of where Branch is, it's about a 2-hour drive to St. John's. Part of the highway is, filled with more potholed and highway. The other part is up on the Trans-Canada Highway. It's about 1-hour drive, or 65 kilometers, to Placentia, which is the nearest larger hub where the ferry comes in. And most people do make this trip out to Costco. So another kind of thing that we can think about in the context for working on the retail food environment in somewhere like Branch is, how much shopping is happening inside the town as opposed to outside the town. And you actually might be surprised. So when we did our initial baseline research in Branch, we found that about 60% of people who are participating in our study actually shop at the corner store twice a week, but there are about 25% of the community that actually shops at Costco twice per month, and about 97% of participants actually shop at the Sobeys in Placentia, which is the nearest kind of major supermarket. It's a smallish supermarket, but still a major full supermarket, and they tend to visit about once or twice a month, and about 16% of people shop there once per week. So to give you an idea, people do frequent the Kareen's Gas Bar for convenience foods, but they do a lot of their shopping outside the community. So that's important to keep into mind when we're thinking about measuring this food environment, as well as developing interventions for it. Branch is also a fishing industry hub. A lot of the boats launch right here out of this harbor, even from the surrounding communities. The husband of the store owner is actually in the fishing industry, and he does snow crab. It's also a tourism hub for the beautiful Cape St. Mary's site that's nearby. And there's lots of community services that are in this Kareen's Gas Bar. So that means that most people are actually visiting the store, not necessarily for grocery shopping reasons, but to go to pick up their mail every day at the community post office, or to get gas, or to pick up hardware. There's a hardware and fishing tackle section in the store as well. And as of last year, there's a restaurant upstairs. The community context is that, it's a very, very engaged community. This was cited in our last year's Vital Signs report as kind of one of the most civically engaged towns in all of Newfoundland. They had 92% turnout at their last municipal election, and the town council 2 times in a row now has been all women. And the current council has been very engaged with us in working on our Healthy Corner Shore research. So this is all to say that I've talked a lot about the people as part of the context that we have to think about, but we also need to think about the business when we're talking about making healthy choices easier. Nancy Milio talked a lot about healthy public policy, and we often talked about healthy public policy as making, the healthy choice the easy choice. But if we go back to actually what Nancy Milio said originally about healthy public policy, she said that it was equally important to address the community as it was to address corporations or businesses. So the question for us in working on the retail food environment in Newfoundland and Labrador and in Toronto, where we've done some of our work to date, is around how can we make those healthy choices easier and the less healthy or less desirable choices kind of more difficult for businesses as well as the people who are running the businesses and whose livelihoods and lives are tied up in the businesses. So to give you a sense of kind of those lives, in that same Kareen's Gas Bar store, the store owner is kind of a long-term, kind of devoted branch community member. She's actually a public health nurse and also happens to own this convenience store. She's a very, very busy woman who's also taking her master's, also teaching in nursing up here at MUN, first kind of selected practice courses, and her husband is in the fishing community, as I mentioned, which is a kind of a seasonal activity, but very, very busy during the season. It's very important to her as a public health nurse to address the needs of vulnerable people in her community, but she's also really seen changes in this town over time, and she's often been kind of thinking about what is her role in kind of providing for those needs. So, for example, seniors in the community with limited mobility, or those kids that might be frequenting her store, and she has 2 young children herself. There's also a lot of assumptions about the convenience store business model. I remember one of our very early conversations with Vivian and I. She said, it's the business when we were talking about kind of what was available in the store and what were maybe some of the opportunities for changing some of those products into healthier options, such as the candy or the snack foods. And she really talked about, there's assumptions in our society about kind of what do you happen to expect to get at a convenience store. Leia in the last webinar talked about kind of replacing, what kind of replacements in a convenience store are we expecting to make? Are we trying to actually replace candy with cabbages? Is that a kind of a reasonable assumption to make? Well, the answer is really no. So the idea around assessments like NAMS, or even kind of as we're thinking about the context for developing other interventions in communities like these, is kind of what's the baseline, what's the context, and how can we make those little bit of shift and squish to improve kind of exposure to potential food environment risks in that community. The final thing is that the convenience store sector is a highly competitive sector. Vivian also owns a higher traffic store that's up in Salmonier, and that store, because it's frequented more often, it has a slightly different business model because it has a different kind of clientele that's related to people who are commuting back and forth from the Cape Shore and area up to St. John's. A lot of people do actually commute that long distance, even for work, 2 hours. So kind of Toronto isn't the only place where people are doing kind of a 1 and 2 hour commute. But that store is able to provide her with a different kind of business model, and in a very highly competitive sector, she sometimes uses that store as a way to bolster up the different model that she has to implement when she's in her smaller home community. So that's a little bit about kind of branch and thinking about the context. So the question is now, how do we begin to think about that context in relation to evidence that we know? And this, by evidence, again, I mean evidence from the literature as well as evidence from other pilot work. So if any of you have kind of have heard a presentation by Brian Cook, let's say, Then kind of you might have heard some interesting evidence about pilot work that's happening in Toronto around healthy corner stores. So how do we begin to apply that to evidence in context? So this chart that I've created here is to give you a little bit of a sense of the questions that we started asking for ourselves in Newfoundland and Labrador when we were starting out this intervention and doing our food environment assessments. So for example, we know that in Newfoundland and Labrador we have a huge burden of chronic disease. So 6 in 10 people actually has at least one chronic condition, and 7 in 10 deaths in Newfoundland and Labrador are due to chronic disease. So why that piece of evidence matters is it matters for population health. We're really concerned about the burden of disease in this province. So how we place that evidence in context is that we knew that action was needed, but what we knew was also that this evidence actually wasn't able to answer any questions about kind of what and how. So that means that the actions that are needed next are to find out a little bit more about the what and the how by thinking about our local context. The second line there talks about causal factors. So for example, in the food environment literature, and I mentioned this already, it suggests a mixed impact of retail food environments on diets and health. And why that matters is that, at the end of the day, we all want to be implementing evidence-informed interventions. We don't want to actually kind of spend time and resources and really kind of ethically, it's really important that our interventions in communities changing lives are going to be evidence-informed. So how we brought that evidence into context was asking this question. It was about, are diets and health actually the main socially important objectives for members of that community, for example, in Branch? Are there other socially important objectives, so such as thinking about kind of vulnerable populations in that community? How about community cohesion? How about actually kind of having really delicious food at the store or having kind of fresh foods available that were never there before? Those are also socially important objectives related to food, and I haven't even mentioned the biggest one, which is often kind of economics. Economics is really important to that community, particularly around many of the small rural communities which are contracting over time. Economic development and sustainable rural development are really kind of at the topmost issues if we're talking about kind of social objectives in that community for the future. So we have to interpret this idea that if there is a mixed impact of the retail food environment on diets and health, is there other evidence that we can find that actually shows the effects on other socially important objectives? The third line talks about options, and I'm going to talk about this line a little bit more on the next slide. And this is about thinking about, okay, so now we think that action is really important, and we have in our mind that we want to measure a number of different outcomes. Well, then what are the options for doing so? So the literature tells us that urban small store interventions are really promising. This seems to be kind of one of the biggest kind of areas where we're showing effects on diets and health in terms of specific interventions related to the retail food environment. So why this matters is that we're able to draw from this literature some ideas about potential impacts. But to place that evidence in context, we know that because a lot of that literature has happened in an urban area and we're really interested in kind of improving rural health in our context, that we need to actually measure the impacts of our intervention, but we also need to measure our assumptions along the same way. And I'm going to get into a little bit more detail later on about how we do that. And then finally, from the pilot data that we've done in Toronto and kind of working with my colleagues Brian and Leia, we know that the store owner is really essential to making healthy corner store interventions successful. Why this matters is sometimes at the end of the day, after we've been doing lots of things, moving fridges, restocking the peas in stores, it's often easy to lose this focus. if you've kind of spent your time going around doing a NEMS assessment, again, it's easy to lose focus because we're so concerned about kind of looking at shelf space and kind of doing those measurements and sharing that data. So this is something that we've always had to keep reminding ourselves to keep in mind, that we need to kind of really always address and measure store owner impact along the way, and that every step of the way in terms of doing our food environment assessments, as well as developing the intervention, implementing it, and evaluating it, needs to offer value to our store owner in that town. So to drill down a little bit more into this idea of the urban small store interventions and how we can kind of test the impact and the assumptions, I've raised this example of this great article for those of you who are interested in small food store interventions. Gittleson, who's kind of done a lot of work in this area in the United States, published this great review in 2012 of small food store interventions, and he really showed that this is kind of a promising area of intervention. However, when we look at the context that he talked about in his article, really, he synthesized that the most literature had been done in low-income communities and with ethnoculturally diverse populations. So the prescription that had come out of a lot of that research, the synthesized result, was that small food store interventions tend to focus on fresh produce, promotions at the point of purchase, and also community engagement, that these are really important. So the idea of testing the impact and the assumptions is that we know that if we want to kind of relate to the literature, we want to be able to kind of do things like testing engagement or testing kind of what happens at the point of purchase. However, we also need to take a little bit of a step back. So if our population is not particularly low income, or if it's mixed income across a wide spectrum, if our population in our jurisdiction and community is not ethnoculturally diverse, then we need to actually take a step back and ask some of these other questions. What do people actually want to eat? Or what do they actually do eat or shop for at the town store? Maybe it's not fresh produce. Maybe it's actually the prepared foods. And actually one of the biggest areas that I think we've learned from in all of this is that healthier versions of prepared foods in stores is a really important intervention area. And this may be related to this idea of the food swamp context in Canada, but it's definitely worth exploring further. And another question we had to ask ourselves is what if the community is already engaged? How do we actually kind of add value to that community when they already have lots of civic engagement and lots of things to do in that community? How do we actually make that store kind of a hub? How do we reinterpret that store in light of that engagement that's already happening? So in other words, if there is not good evidence, or if the evidence is really mixed for an intervention in your context, it's not necessarily about kind of inaction, but we really think that it's about strategic action and thinking about social impact. And again, kind of this reminds you that data makes people think, stories make people act. So do you have stories, and do you kind of understand how life works in those communities, and can you actually take strategic actions to shape that? An example of kind of how you can begin to think about this is another initiative that we did related to our Healthy Corner Stores project. Was at the beginning, when we were beginning to explore this, was to think about actually doing an assessment, but actually having the assessment be the intervention. So the Food in This Place was a public engagement workshop that we held in partnership with those partners that you see down there below. And what we hosted was a food environments workshop downtown. We held it on a Saturday morning. We had food and served lunch, but what we did was we actually trained a whole room of members of the public to do a mini version of the NEMS in retail stores. We had a couple of fantastic public health students from our master's program who helped to coordinate all of this activity. And what we did was we set up teams, and the teams from the event actually went out in the second part of the event. They went out to local convenience stores all around the downtown area. We had a couple of people go up to the nearest supermarket as well, so they got to experience their built environment, the weather. I think the weather was actually okay that day, which was lucky for St. John's, so we were really lucky. And then we had them come back, and then over some beautiful sandwiches from Rocket Bakery, we got to talk about kind of assessing the food environment and the potential interventions that they could already see were necessary. So this is kind of the process of intervention design through assessment. Another example is kind of thinking about this idea of framing. So this was a poster that we had kind of shared in advance of the event that was created for us by a great communications person. And, he asked, do you live in a food swamp? It's kind of a provocative question. And there's been some writing in the food environments literature that is pretty interesting in rural food environments about, does the food desert concept even apply if we are talking about it in an urban area and then begin to apply it to a rural area? Well, some rural researchers have actually argued how it's actually important for us to use framings that are widely understood by the public. So they tend to actually frame their work in terms of food deserts, talking about how if they're in a rural community and they have people in that town who are actually commuting about an hour in a vehicle to the nearest town, and if you'll remember when I was describing the context in branch, that's exactly what people are happening. People are kind of making it out to Costco. Well, then maybe we need to actually think about it in light of the food desert literature in addition to the food swamp literature. Another example of kind of strategic actions is if you kind of have a really kind of anxious and ready-to-go group and an innovative group who kind of is willing to take a lot of risks, then maybe one of your first steps is actually about taking action. But because you don't necessarily have that evidence in advance, it's that every step of the way we need to actually gather evidence about context and behavior as we're taking those actions. So two examples, again, from our branch intervention, were on the left-hand side, we actually implemented a loyalty card system in the store. But it wasn't actually until we were using the loyalty card system to collect data for the store, partly related to the intervention, but also partly to kind of promote shopping at the store, that we realized that there was some context that we had no other way of finding out until we had actually produced those loyalty cards, which was, you'll see in the little picture above that it's a tiny little kind of key fob size card that you're meant to put on your key ring. Well, what we were finding that people weren't using their loyalty cards. And finally, one member of the community told us that when people actually go visit that store in the community, they do tend to drive. They don't walk because it's not a really, really walkable community. They do drive over to the store, but because it's a small town and that's what they're used to do, when they run into the store to kind of pick up a little sandwich or a bag of chips or kind of whatever they're picking up, some nails from the hardware section, they're not actually going to take the keys out of the ignition of the car when they're going in. So that actually was a key barrier to use of our loyalty card system that we had not even predicted until we put that intervention into place and found out what the actual effects were in that context. And I can tell you that this kind of piece was never kind of documented before in the evidence that we had gone through. So these are the important parts of gathering evidence about context that are important. On the right-hand side, we had the example of fresh sandwiches. So before we actually started to change the products in the store, we had lots of discussions with store employees about kind of what are the opportunities for making the food offerings a little bit more health-promoting. And one of the really popular items inside convenience stores in Newfoundland and Labrador are called Smith's sandwiches. So Smith's is a brand of sandwiches. And these are kind of widely available in every single store. They are fairly inexpensively priced. They have a very long shelf life, and I would consider it the less fresh, less healthy options available. So when we were talking about introducing fresh prepared sandwiches in the store employees were actually a little bit concerned and said, people have been buying Smith's. The fishermen come in, they're coming in to pop in for their lunch, or they actually take lunch. Like they'll come in and they'll buy a number of subs and take it out on the boat for a couple of days and keep them. So these are what people will expect, and we don't think that people will ever really convert to buying this alternative product. Well, it turned out that that there was a whole untapped market for freshly prepared foods, so that this was actually an example of if we built it, they came. And so the store now has actually, within just a couple of months, probably about 6 weeks of introducing those fresh sandwiches, that they've actually almost stopped ordering the Smith sandwiches altogether. So all of this relates to something that we call theory of change in intervention research. So theory often sounds pretty academic, especially when academics like me are talking about them. But the thing that we want to remind you is that theories are something that you have every day. You probably have theories about how your day is going the way it is. You probably have theories about why your in-laws are serving you roast beef at Thanksgiving dinner again, when they know that you don't eat beef and you only eat poultry. So we all have theories, and when we're doing intervention research or we're trying to apply complex interventions or complex assessments inside a real-world context, the question that I always ask my students is, what's the theory of change? What do you actually think is going to happen when you put that sandwich on the shelf? What's actually going to happen? Let's walk through it. Let's talk about a story of what might happen when customers start to walk through the store and they see those fresh sandwiches. And this storytelling can actually begin to shed light on what kind of behavior changes that you're predicting and what outcomes and outputs that you're actually trying to measure. The other idea of the theory of change is sometimes, I think, when we're developing complex interventions for a real-world setting, is that it's easy to get hung up in the idea of complexity. And complexity is complex. It's the idea that there's so many factors at play that it's really, really hard to get started. Well, we got some great advice a number of years ago from the Nudge Unit in the UK, and this really great strategic fellow said, hey there, it sounds like you're taking a kitchen sink approach to your intervention. And I really kept that terminology with me ever since. And that it's okay to actually start with a kitchen sink approach. We actually go into the store, we throw everything that we possibly can at it, and we do our best to measure outcomes. And then it's the next step and the next step and the next step to begin to break that down. What are the components of the kitchen sink, and start to break down those specific outcomes that come out of it. But if you're just getting started, then a kitchen sink isn't bad at all. Another part of theory of change is thinking about what do we expect people to do, and how might people actually surprise us. So there's a lot of writing about how rural shoppers are actually motivated to shop in their town out of loyalty. This idea that rural communities are really, really cohesive, and that's why when we're thinking about retail food environment interventions, that we have to build loyalty and even think about things like loyalty cards. However, if you look a little bit more at the context and look at not the health literature, but some of the marketing literature in this area, what they found is that it isn't about community attachment alone, it's about store satisfaction. So if shoppers in rural communities are actually shopping at their town store, not out of community attachment, but out of satisfaction with the store, then it's even more important that our intervention focuses not necessarily on that loyalty to the store, but about making them really satisfied and delivering on the products that they expect at a high quality and freshness. So this kind of so all of this is really kind of reminiscent of the trajectory that was talked about in the Food Environment Assessment Manual, which is, we begin by mapping it or measuring it. We begin to layer it, we share it, we act on it, but then we always try and keep in mind this feedback loop of action so that every step of the way, we're always feeding back and asking ourselves questions again. So to help you kind of do this and to help you apply evidence in context, we were hoping to have kind of our website ready for launch so that you could play with it even kind of right after this call, but we're a little bit delayed on our website launch. That'll come available in the next couple of weeks, so please stay tuned about it. I'm going to share the URL at the end of this call. But on our Freshit website, you'll be able to actually look at an evidence application guide and do some of the work through some of the examples, just like I've worked through so far on this webinar. So the evidence that we have here is based on key food environment syntheses by our team that it collects all of the latest literature and all of the latest intervention work and synthesizes it, and we organize that application guide by the aspect of the food environment that you're interested in. We've talked a lot about stores because that's where a lot of our pilot work has been done, all of our intervention work. But I know there's other people in this call who work on areas like rec centers or food environments in schools or food environments in vending machines, thinking about kind of the hospital setting that I'm sitting in right now. So you can kind of look up your aspect of the food environment and think about that a little bit more. We've also organized it by evidence context, so you can kind of see what's happening in urban or rural and remote or by subpopulation, and some key questions to think about, which are kind of related to what I've been talking about so far here. So the next part of this, thinking about relevance, is kind of once you have this, all of this evidence, so you've started to develop some interventions, you might have done some measurement as well. This is kind of projecting all the way to the other end, which is thinking about policy. And even as you're beginning your assessments or intervention development, you might already be thinking about policy because after all, as we were talking about at the beginning, healthy public policy sets those really supportive conditions. So maybe your interventions would be more successful if you could actually develop a supportive policy environment or cultivate that along the way. Well, so there was a question from the last webinar about kind of are there examples of food environment assessments where or food environment evidence that really informs policy options happening. So for an example, we have actually done a knowledge synthesis, which has been actually turned into a smaller, shorter summary report working with the National Collaborating Centers for Environmental Health, and the contact for that is Karen Rideout. So we've been working with Karen to think about kind of what are the policy levers that communities have at kind of on hand that they can begin to tackle their food environments and make that more supportive alongside doing all of the other things. And we've divided it. I've given a little picture of the summary report there, but those resources are available from us and from NCCH. If any of you are interested, we'll be happy to share those. But we've organized it along the lines of 4 groups of policy options that are really promising and that are already happening across Canada. So you can find examples there of options, but also of jurisdictions who are doing things, and then you can begin to think about how those apply to your own local context, including things like planning for health, which includes things like zoning or licensing regulations. And a great example of kind of how to think about that is, for example, if you have high school students in the community and you've done a little bit of an assessment and you found that there's actually 12 fast food outlets within a 5-minute walking distance of that high school, well, then one of the things that you might want to do is you might actually want to explore zoning regulations. You might want to think about kind of planning of that neighborhood around the school environment. And there's some great examples, for example, from Quebec about this type of thinking, applying local bylaws and zoning regulations to thinking about that fast food outlet piece of evidence. The second one, oh, and I'm just seeing here in the comments there that there's a link already there from Karen, so that's fantastic if you're interested in downloading those reports. The second area is about transforming consumer environments. And as I said, if you've kind of worked with me and Leia, you've heard a lot about kind of the consumer environment already, so I won't spend any more time on those. But there's two other kind of groups of policy options that a lot of communities are starting to explore. And the third one is economic and fiscal tools. So this includes things like using their public purchasing within public sector organizations, which could include hospitals, but it could include kind of town halls or town councils or local government. Can they use their public procurement dollars, if they're going to spend that money already, into buying a greater proportion of fresh foods or local foods or healthy foods? Or nutritionally or nutrient-dense foods. And I introduced kind of all of those potential options because they may be differently important to different communities. Another example is around the culture of transparency and participation. This is where a lot is happening. And the example that we use in the report and also in a related paper that's going to be coming out in a special issue of Canadian Journal of Public Health coming out in the next couple of months is the idea of food policy councils. So in Newfoundland and Labrador, we've just founded our first food policy council, the St. John's Food Policy Council, just in the past year. And one example of a lever that we've really been thinking about in relation to food environments and about kind of the retail food sector is around the issue of food waste. So I won't spend kind of too much time talking about that anymore because there are other resources, but I'll encourage you to kind of raise questions about those in the question period if you have some, as we're kind of getting near to the time. But I wanted to spend a few minutes now towards the end of our call also highlighting the work of our friends in Alberta at the Place Research Lab. And thank you to them, and particularly thanks to Kim Rain, who's an investigator with us on our Fresh It project, for providing a lot of access to Alberta resources to us and kind of helping us along the way with it. So the policy readiness tool that comes out of the Alberta is based a lot on this idea of policy diffusion. So this is an old organizational and behavior and innovation theory by Rogers that talks about kind of if we're going to think about implementing something new, doing these big social changes that we're talking about, what's the likelihood that our community is actually ready to do that? How can we begin to predict, and how can we work with our local policy environment to get change started at any stage of the game? So the policy diffusion theory looks at the idea that when you start an innovation in place, you may have this kind of layout or a bell curve of when people are ready to adopt it. So is your community, for example, very innovative, or are they early adopters for new types of interventions, even in the absence or kind of even with less evidence in place? Does your community have a high tolerance for risk? Or are you part of the majority? So there's early majorities and late majorities. And majority communities tend to be those who engage in very deliberate decision making and draw in kind of a wide array of jurisdictional influences before making the decision to implement an innovation or intervention for their own community. And then the final stage is laggards. It's not a very kind of nice word, but it's from the theory. But the idea of laggards is that these are the people that kind of wait until the messaging and the evidence is totally in, and it's almost kind of inevitable that they adopt it by the time the full majority and the innovators and early adopters have done so. The policy readiness tool from Alberta introduces a questionnaire that you can all work through for your own communities, and many of you on the call may already be familiar with it from joining other webinars related to the policy readiness tool. But we also think that the policy readiness tool is a great way to think about retail food environments, which is why we've added it to part of our retail food environment intervention toolkit for working on the food environment. So I'm going to just go to the next page. So what the policy readiness tool talks about is that there are a couple of enabling factors that can really help you get policy change started in your community. And most of the theories around this talk about critical moments, such as windows of opportunity, or really critical people. So because we know that these things are important and they're really important in the policy readiness tool, what we've done is we've created a little bit of a community of practice hub. We've just started it with our pilot sites that are part of the Fresh It projects. And we are going to use the website to post examples of actions and assessments that are happening. Also some kind of key facts and key evidence that are emerging from these communities, so you can begin to read about what's happening in different food environment settings and in different contexts and begin to apply them to yours. So we're hoping that this kind of interactive map that we've created on our website will grow and grow as we begin to hear more of your stories about how you're piloting this work and doing food environment assessment and intervention across the country. And this is a link to the policy readiness tool. I should put this slide kind of a couple of slides ago so that you could see this first. So I really invite you to visit our friends in Alberta at the Policy Readiness Tool and explore their website. The section on readiness levels talks a little bit more about that idea of adoption of innovations that I introduced a couple of slides ago. And there's a great questionnaire there, as well as key strategies. So what if you do find out that your community is a laggard? Well, there's no need to despair. The Policy Readiness Tool actually provides key strategies that you can use at any stage of readiness. And there's also general strategies that you can use at any stage of readiness as well. So to give you an example about how some of the strategies in the Policy Readiness Tool can be related to some of the evidence and context and policy context that I've already talked about, the Policy Readiness Tool, for example, on the far left says that if you have a community, if you're living in a community and you think that your community is an innovator or early adopter, then key strategies that you can use are making sure that you frame whatever you're going to do as innovative. Another recommendation or another recommended strategy is to build relationships with key champions to really kind of get the ball rolling. So this relates to one of my earlier strategic actions that I mentioned about maybe it's time to not actually strike a committee and develop a long food environment assessment tool. Maybe it's actually time to start acting together on an intervention. And by that, you can actually work on your food environment and collect evidence along the way and take advantage of the state of readiness of your community. Second evidence, if your community is in the early majority or the late majority, the Policy Readiness Tool suggests you can promote evidence. It's really important to actually make sure that that decision-making process has a firm evidence base and also a strong public opinion behind it. So that actually relates to our previous strategic recommendation of using measurement as an intervention. This would be a great opportunity to actually carry out a food environment assessment and then really be sure to feed that data early on and regularly to decision makers and a wide array of stakeholders in order for you to actually influence policy change. And then finally, a strategy that the Policy Readiness Tool recommends around communities who are more cautious or more conservative in terms of policy change is to really get at these underlying barriers and to begin to educate decision makers. Here, again, it's the idea of this sharing data that's probably most important from today and for all of the webinars so far. I can't kind of emphasize enough that if your community is in this stage or at this stage of readiness, then what you want to do is you want to do a lot of myth busting around the food environment. You want to use evidence to your best advantage to educate decision makers and change the tone of that conversation. So I was just kind of talking with Leia before this call, and when I prepared these slides, I put in this bread slide because it's one of my favorite bakeries in Toronto, and I had a really good kind of comment to say about at the end of the day, this is going to all cost us some money and talk about the dough. But to be honest, I can't actually remember the really good comment that I was going to make now. So I'm just going to leave this to you as a little bit of food ogling for bread, and I think we're going to move into the question period now. Thanks, everyone.
So maybe, Kathy, this is Leia, and I will just point out that Ellen has asked, can you provide more info on the paper you said was coming out in a few months for the Food Policy Councils, and I believe that was referring to the Canadian Journal of Public Health supplement that's forthcoming, where you talk about the policy levers at the city region level.
Oh, yes. So that is, actually I should kind of turn this over to you, Leia, because Leia is the co-editor of this Canadian Journal of Public Health special supplement on retail food environments, because it came out of some work that she was doing with Rachel Engler-Stringer.
Right. So, okay, yeah, so this is this actually should be coming out in the next few weeks, I think.
Is it that soon?
Yeah, I'm pretty sure. All of the papers have been accepted, and they're going through copy editing now. One of the things that we were talking about is that I don't think the articles are going to be open access, which we're going to try and figure out if we can do something about, because I know that's one of the problems in public health, is that not everyone has access to the same kinds of academic materials, which is sometimes not helpful. But anyway, one of the papers in this is very similar to the NCCEH report that Karen had provided the link of, about food policy councils being an example of transparency and community engagement around food in different sort of city or municipal contexts. And so and so that's one of the ways that people can get engaged and kind of be acting on the food environment through things like food policy councils. And I think I'm sure that Kathy and if you want to learn more about that, you can read the NCCEH report, and also just be aware that a similar paper will be coming out in the supplement.
And the supplement also has a number of other articles. I feel like we're doing a little bit of a song and dance, a little bit of an advertisement for that supplement. But I'm really excited about the pieces that Leia and Rachel assembled in it. So there's a scoping review of the food environments literature in Canada. So that kind of brings out some of the key points that I was introducing right at the beginning when we're talking about the state of the evidence. That'll be really useful, I think, for practitioners and decision makers on the call. And then there's other kind of work that really draws on specific local context, that crucial context piece. So there's some great kind of rural work out of Quebec that I believe is one of the papers, and a number of others. And Leia has written a beautiful introduction. So I encourage you to all kind of look for that supplement if you can, and try to find access to it.
Lisi has a question about the link is forbidden. I think also, Lisi, if you try Googling, Google the policy readiness tool, Alberta or something like that, there's a bunch of different links that come up, and some of them seem to be working for me and others not. But it is available. I guess you just may have to figure out which link works and for which kind of browser. There's
a number of links, because there's a link to there's the tool itself, which is the screenshot I showed, actually lives on its own website, but it's also part of Kim Rain's Power Up for Health website, and then we're going to have some links to it on our Fresh It website. So there'll be a number of ways to access it, but if you're still kind of having trouble getting to it, there's downloadable PDFs of it as well, or if you're in a community where kind of you don't have great internet access, we can also send you the PDFs, and you can still work through all of the examples in the questionnaire and the strategies. So there's a question from Lynn about the community of practice and how people can join in. So what we're going to do is we're going to use that. So we're hoping that the Fresh It website actually becomes a little bit of a hub for that community of practice. We're going to post access to all of these different tools that we've been talking about over the webinar series there. But we're also going to use it as a place to tell stories about what's happening in each of the regions. We're going to start with the profiles that we have with our Fresh It pilots, and then we're also going to add from the Health Canada pilots that are also going forward, which are the Health Canada pilots of the Food Environment Assessment Manual over the next year. And as I said on this Q&A slide, we're really excited for you to share your story with us. Kind of once you see some of the profiles and some of the work, then we'd really like to communicate with you so that we can kind of build up and populate that map of food environment work happening. Oh, what will be the Fresh It website URL when it's launched? And it's because, I have it on, I think, on the next slide. So I'll just flip over there for a second. So the Fresh It website is going to be fresh-it.ca, and that's coming soon. Thanks for asking.
And the hyphen is there for obvious reasons.
I was trying to be delicate about it, Leia. So the other that you don't realize until after you buy domain names.
Exactly. So if there's no other questions at the moment, maybe we can just give you the gift of 20 minutes in your day, and follow up with us if anything does come up in terms of questions. I think you'll probably hear more from us as the days go on and as the Fresh It tool, the website becomes more available and all that sort of stuff. But thank you so much for participating. We were so surprised and delighted that so many people were able to make it to all of the 3 webinars, which has been fantastic. And if you have any suggestions for if you have ideas for future webinars or that kind of thing as well, please let us know.
Yeah, so thanks very much, Kathy and Leia. It's been great presentations, and it's nice to see some of the feedback already coming in that people have really appreciated and found it interesting, and some people even overwhelmed by the amount of great information that you've shared. So it's been really good.
Yeah, there's just a question actually from Richard Gould about thoughts about how to define undesirable food outlets in a food swap to inform zoning. Mm-hmm. So that has been actually done in Canada. It happened about. Pardon?
Oh, go ahead. Sorry.
Oh, in Qualicum Beach on Vancouver Island, there is the one municipality that I know of that actually has language very specifically defining fast food outlets, because 30 years ago or more, the city decided we don't want our beautiful little town of Qualicum Beach becoming a trashy strip where, the tourists come to go to the beach in the summertime and it's all full of fast food outlets. So they very specifically defined restaurants in their land use codes to be including table service. This is much more specific than most land use restaurant classifications, and so they sort of disallowed the ability of fast food outlets from opening within their community. So there's also a great resource that's mentioned in the Food Environment Assessment Manual for Health Canada that the Coalition Poix from Quebec created about, I think it's called Zoning for Health, or it's about basically the power of urban planners and the jurisdiction that they sort of legally have the right to very specifically define land uses so that they can actually zone for specific healthy food retail and also restrict the opening of things like convenience stores or fast food outlets. So people have been talking about that a lot and thinking about it, and they had a municipal lawyer go through all of the legislation and see whether or not it was within the jurisdiction of urban planners to do that, and they found that it in fact was. So, and someone is also saying that...
I see somebody citing an example specifically in Quebec, so that's really interesting as well.
Yeah, so thank you for sharing that as well. So it's something I think a lot of people are starting to think about and talk about, and not tons of people have implemented yet. But
I also I think there's a citation to that same Quebec report in the policy options paper that's coming out in the special issue, and there's also a great review article on kind of how to think about zoning as a policy lever. At all, a great review article, and that's also a reference in that policy paper. So hopefully that'll be useful.
Okay, well, again, thanks, everyone. Thanks so much for joining and for participating in the discussions. Have a great day, everyone.
Thank you.
Thank you.